carcinoma with good prognosis. So high, when they say high means it's more than 14%. More than 14% means it's gone in luminal B, which is not the best prognosis, of course. BRCA1 tumors are usually triple negative. We know triple negative wale to are bad ones. They are bad prognosis tumors. And P53 is also P53 syndrome. That is always policeman going problematic is always bad. What is good for the patient when you're talking about these cases is going to be ER positivity. ER positivity and not having a high Ki67, matlab somewhere in that luminal range. Somewhere in that luminal AV wala range, that is what they were probably hinting you towards, and yes, that has a good prognosis. Surgery patho mixture kind of a question came, and I think all of you attempted it well. Okay, simple. Shall we move on to the next one? This was again a quite an expected question. We knew that lung tumors will get us a question, lung carcinoma pe question aayega. So what you had was a chronic smoker. As soon as you get a lung carcinoma, and the description was classical of a carcinoma. There were large pleomorphic cells, there was a mitosis, there was no doubt about a carcinoma. And as soon as they say carcinoma, you know for a fact is smoker hai, smoker SSS. There are only two cancers mainly that I think in lung for smoker. Either it's a squamous cell carcinoma or a small cell carcinoma. So I had both in the options, and now I had to pick up which of them had hypercalcemia. See guys, if I don't know if this was the somewhat the question that they asked you. If they would have asked you which of these has maximum paraneoplastic syndrome, you would have marked small cell. But if they particularly asked you about hypercalcemia, then your answer is squamous cell. If you remember in that Jan 31st wala session also that we had in rapid review, I told you lung cancer aayega, definitely aayega. So squamous cell, we have studied that squamous we will write with calcium. So squamous cell carcinoma mein calcium is going to increase, very important. Paraneoplastic syndrome and lung cancers, but one question is either markers or PNS, that is your PYQ take home message, and you knew it was gonna come. So I hope, fingers crossed, that all of you got this right. Okay? Large cell neuroendocrine carcinoma, Dr. Gaurav, is a totally different entity. Of course, it comes under neuroendocrine variety, and it is very different. Large cell carcinoma only further has many different parts, and neuroendocrine markers will be there in it. Salt and pepper, chromatin, wo bhi nahi hoga to markers, synaptophysin, chromogranin. So neuroendocrine word only takes me into a different world of tumors all together, right? Okay, chalo. Now going to the next one was this. Again, this time they did not give you that famous African bacha, I suppose. Do you remember that African kid with the jaw swelling who's a celebrity who comes in every exam? But I think this time they did not give him too much of importance. They did not want to make him more famous in our country, but they gave you somewhere related to this tumor with vacuolations. And anyway, when African child jaw swelling and vacuolations were there, what were you going to think of? Yeah, so if this picture was not there also, either way, they give you the description. Jaw swelling, African kid, and you know that you're dealing with perfect Burkitt's lymphoma. Burkitt's lymphoma also shows you these vacuolations. For students going into INI, CET, Burkitt's lymphoma vacuolations are oil red O positive, yes. And you know, Burkitt's, so we had studied, Burkitt's looks like what? Burkitt's looks like 8. So 8 had to be with an even number. ये वाला rule सबको याद था ना? 8 had to be with an even number. So it was translocation 8 and 14 for Burkitt's lymphoma. That was there, and of course, some other options must have been there, but उसमें कोई confusion नहीं था. That is why I'm not bothered right now to gather other options, because I know for a fact that if 8 and even number was given, then there is no other option possible that they could have given you. So this is definitely the answer in this case. Okay, if African child was, even if it was not mentioned, then they were not probably wanting to tell you the endemic type. They were not wanting to give any importance only to that kid. Even if the jaw swelling evacuations was there, even in that scenario, the most common tumor that you would think of is Burkitt's, because Burkitt's occurs most commonly in the jaw area. That's also the endemic variety only. Okay, chalo, moving on to the next one, a question which has had a lot of confusion, which shouldn't have, but unfortunately hua hai, is what I've seen. Because everyone believes that when these round spherical cells come, the question ka answer hai hereditary spherocytosis and osmotic fragility is what is like your first thing. Before that, Dr. Suraj said 821 is there. See, 8 could be there, but if it's an even number only, then you think of Burkitt's. Just in case, you guys will have to tell me, just in case 821 was there, guys, that is a translocation that you see in AML M2. So that must have been a separate question, or they must have given you for confusion. 821 cannot be seen in Burkitt's. 822 can definitely be seen in Burkitt's. So 8 ke sath even number hona chahiye. That is the concern that we have over here. Is that okay? And if 821 was given, that is AML M2. Okay, chalo. Now coming back, and either ways, 814 happens to be the most common. So 814 he answer is में. This was no source of confusion out here. Moving on to the next one. spherocytes, everyone starts thinking of HS, but no, the most common cause. What is the most common cause of spherocytes? Spherocytes have three causes. Spherocytes have three causes. One of them is autoimmune hemolytic anemia, which is the most common cause of finding spherocytes. If they would have said कोई family history है, autosomal dominant है, then you would have thought of hereditary spherocytosis. If they would have said some X-linked recessive family history, you would have thought of G6PD deficiency. ठीक है? So any of those were not mentioned. You have to pick up the most common cause. The most common cause is autoimmune hemolytic anemia. The test that we do for AIHA is POOMS, isn't it? So here the answer on the basis of this much history, no family history given, so definitely अच्छा. Then okay, if you say that there was a history of jaundice that was present, why not? Autoimmune hemolytic anemia is also hemolytic anemia. The history of jaundice to ho sakta hai. There is no concern about that. Even if it is a child who's 10 years of age, just because of 10 years of age, you are not going to change the question to or the answer to hereditary spherocytosis. The overall most common cause of spherocytes still remains, AIHA. Only reason when I would want to change my option to HS is if this only you can tell me. If there was a family history present, then the entire game is going to change out here. If then, so then I can easily see that you have to mark HS. Now, some of you are saying it, and some of you are saying no, so then I cannot comment on that till I get a final consensus on whether it was there or not there. But I have told you, so now you need to suit whatever is coming in your mind. If family history tha, so HS you can change, and if family history was not there, then you will go for AIHA. Okay, so again, everyone giving me mixed answers, so I will not commit to that. I talk to more, 100, 200 more students I will talk to, and I let you know कि tha ya nahi tha. Okay, but both scenarios are given you the answer. Okay, let's move on to the next one. Again, you had a young child, some said 5 years old, some said 8 years old. Overall, bacha chota tha, so that really doesn't make much of a difference. Cola color urine, mild puffiness, elevated creatinine. Some said creatinine 2.5, some said 2.2. These were the values that we got. History of impetigo was also given, and they asked you where would you see the deposit. So what is this? What is this going to be? No, this is not pre-recorded. This is very much a live session. What is this going to be? This PSGN. Perfect. This is a PSGN making sense. No? This is PSGN to pediatrics. No, chota bacha, P for PSGN, P for pediatrics. And what do you see in PSGN? You see the classical subepithelial humps. Someone said that there was also, the presence of PSGN stayed for more than 3 weeks. That was there. Many of you on the basis have said because PSGN stayed for more than 3 weeks, that is why we thought that, I know some people did a little bit of overthinking. Okay, ma'am, PSGN has stayed for 2 weeks or 3 weeks. That is why we thought that it has changed into RPGN, and that is why we ended up marking crescents. How many of you actually went into this? Yeah, so many of you did think of crescents also. But no, guys, PSGN when you go into medicine and you see, do we give any treatment for? I'm telling you the exact line from Harrison. Do you give any treatment for PSGN? No, it's just supportive treatment. Because they say that within 6 weeks, within 6 to 8 weeks, this is a self-limiting disorder. Within 6 to 8 weeks, it is a self-limiting disorder. So if 2 to 3 weeks was given, you're not going to call it a case of RPGN. Okay? So yeah, so maybe the patient is deteriorating, I can understand that, but primarily it's a case definitely of PSGN, and what you would mark would be the subepithelial humps. Okay, abhi ke liye done. No, subendothelial does not come. Subepithelial humps, that is the answer. But there was one more stuff. See, subepithelial में 2 options होता है, and this time the examiner has done that. How many of you agree that एक ही question they picked up one topic and they got after it? Like in biochemistry they picked up vitamins, and I think everyone's telling me there were 10 questions that came on vitamins. Same way when they picked up subepithelial humps, so PSGN वाला question भी डाला, and what is the other condition that shows you subepithelial humps, which is also known as the spike and dome pattern? So that question was also there in the same exam. The membranous glomerulonephropathy was also there in the same exam. So I don't know why they're doing it. It's not a very good thing to do. Honestly, because what if किसी ने नहीं पढ़ा था? What if someone who could not revise vitamins? Now that poor kid has lost out on 10 questions or 8 questions just because he could not revise it in the last 15 days. Paper should somewhere be balanced. They should give like one question from every topic rather than just getting after one topic and taking every nitty gritty and detail out of it. It should not ideally be done like that. But these are things which are not under any of our control. These are things which best known to the organizing committee, of course. So that is why I did not get the option. And in that area, said that there was a history of hepatitis B that was present. Yeah, these are the bits and parts from students that I have received up till now, little catchwords. But whatever I got, chahe elderly ho, chahe hepatitis B ho, or subepithelial ho, or spike and dome pattern ho. Either ways, for all of them, the answer that I got was MGN. There was nothing contradictory for MGN overall. Okay, someone asked me subendothelial deposit. Subendothelial is different. Subendothelial is going to be seen, number one, it can be seen in a case of MPGN type 1, and secondly, it can also be seen in that bioloop region that you see in SLE. So a totally different situation where you do subendothelial deposits. Okay? Right, but spike and dome mentions are then. So see, I hope you remember if you had heard the January pathology class on renal, I have taught you that whatever happens in the peak of the age and shows you peak of the pattern is MGN. Peak of the age, elderly, and peak of the pattern, spike and dome, that was MGN. The same thing was picked up over here. So the spike and dome, kuch naya nahi tha. It was a pretty straightforward repeat question. This part you cannot blame anyone. This you had to get correct. It was totally in our hands to get this correct. Okay? Right. So again, Dr. Nandita, we just discussed that hepatitis B patient with spike and dome pattern, MGN is sorted. Right. So let's move forward. This is again something that again everyone's giving through a different history. They said that there was organomegaly present, that is hepatosplenomegaly, petechial rashes were there, and ulnar appearance were there. Some of you are saying outlier appearance of the urine was mentioned. Some are also saying of the stool was mentioned. Okay, too many things are there. So I did not focus honestly on the stool or the urine because I know for a fact that if an organism is asked with outlier appearance, urine or stool consistently doesn't matter. I believe urine hoga because for cytomegalovirus, as far as the text goes, they say that urine washings are the best sample. Urine washings are the best sample is what they say for cytomegalovirus. So ideal situation is the urine sample should have been given, but it's examiner ki merzi, he can give you anything, right? So urine washings, everyone's agreeing with me. Okay, thank you guys for confirming that. So whatever was there as expected, वो वैसे दिया था. Sudden obsession. How many of you agree कि मतलब outlier के साथ they have become like totally obsessed? FMG exam में there were 2 questions only related to outlier, and this time with CMB also they got obsessed because this was not the only question on CMB. Some congenital CMB was also asked. Yes, Dr. Emmy, you were right. Congenital CMB is related to questions which I'll come to in a while. That periventricular calcification question also came. So this time, again, they've been following this ever since 2020 lockdown के time से ना. They get after one question, one topic, and then they give 2-3 lines of questions. They give it somewhere bad, but this is being done nowadays. We'll come to the periventricular. Also, this is another question which created a lot of controversy. I've seen on Telegram groups since evening everyone discussing. So I thought let's finish it off. 5-year-old child. This same question. See, 5-year-old child bleeding per rectum and rectal polyp. Stop the question here. Exact same sentence picked up from Neet PG 2019. Same to same. Difference क्या था? Neet PG 2019 they gave an image along with it. Image is basically useless because diagnosis has to be made from the clinical part given. Bleeding per rectum, rectal polyp. So rectal polyp तो पता है, and it's a juvenile वाला छोटा बच्चा. So this is going to be a juvenile rectal polyp. And we know that juvenile rectal polyp comes under the family of what? It comes under the family of hamartomatous polyps. So it was as simple as that. Instead of giving the photo, they said there was colonic epithelium with mucin that was seen. Fine, that is exactly what you see. And a little bit of, I don't know whether this was there, but if I would have been an examiner and I would have been trying to confuse you, I would have written colonic epithelium with mucin along with presence of inflammatory cell and little bit of fibrosis. There's some pathology ka na, 2-3 big words I will add for you so that you guys get totally confused that oh shit, this is a pathology question and I'm like totally gone. But ultimately, if someone thinks with a calm and composed mind, bleeding per rectum, 5 साल का बच्चा, there is nothing else possible other than a juvenile rectal polyp, है ना? तो यही है जो हो सकता है. Many of you said carcinoma, तो ध्यान से सोचो, 5-year-old child is not going to have carcinoma, ठीक है? Then choristoma is said to be some ectopic tissue. This was not ectopic. There's nothing ectopic in it. I mean colorectal, ma'am, why not adenoma? Because don't you have that basic concept? GIT में anywhere I use the word adenoma means I am talking about a pre-malignant lesion. Guys, think logically ना 5 साल का बच्चा comes down to the age again and again. Why are you trying to put it towards that pre-malignant cancer? वो वाला zone. He's a 5-year-old innocent tiny little kid. Think of common things first. Think of juvenile rectal polyp first, and that is the answer over here. I hope your query sorted, Dr. Gaurav. Why not adenoma? Adenoma and GIT like fab हो गया, या tubular adenoma or any other adenoma. Supposed to have some pre-malignant changes, and they've given you the entire epithelium. If they would have written epithelium was showing bad cells, atypical cells, I would have also thought of adenoma. Bilkul, I would have also thought of, but they've given you the findings. Colonic epithelium just with chota inflammation bus. So this has nothing to do with the pre-malignant condition. Sorted? Okay, let's move on to the next one. Super simple baby question that came in this paper this time. Don't know why it was given, but one histology question so has to come. And the options were so bizarre as some of it. This was a clear-cut round structures which were very characteristic of calling it what? Calling it glomerulus, है ना? So calling it glomerulus was very characteristic. तो था exactly why and how would they want to call it islets of Langerhans and all? Bilkul pancreas से related, maybe because they copy pasted it from the FMG वाला exam. Because FMG exam में picture was given and the answer to that was islets of Langerhans. They probably changed the photo and changed the answer to glomerulus. One option was Hassel's corpuscle. Even if it was an option, I mean, जब तक photo ये था, I have no doubt. There cannot be any doubt. But yeah, whether the photo was this or not, that you guys will have to confirm for me. But if the photo was this, I can give you a 500% confirmation that this is the picture of a kidney and this is definitely a glomerulus. Unless there was a change in the picture of then that if ये picture नहीं थी, what I can do is I can bring out more pictures on Telegram and I can share with you by the end of the day. If you're saying Hassel's corpuscle stuff, so some of you are saying same thing था, some of you are saying नहीं था, because what I got on Telegram the students was this picture only, exactly this picture everyone shared with me. Still, अगर कोई doubt है, I'll share more pictures of Hassel's corpuscle. You can give me a lesson, nobody come to an answer. But islets तो definitely नहीं. So most of you are saying same picture, so then the glomerulus I can give it to you in writing. This is the most confident thing that is there. This is definitely kidney and the round structures are all the glomeruli that you're seeing. चलो 200% मिल गया तो फिर तो पक्का है, sorted. ठीक है, let's move on to the next question. Here you had a question over here. Yes, you had an HIV positive patient, and then you had a bronchoalveolar lavage culture was negative. Culture negative मतलब it's a non-cultivable organism. पहले तो ये हो गया था non-cultivable organism. And Gomori methenamine silver stain showed you what? It showed you the crescent-like. अब देखो क्या करा? They did not write crushed ping pong ball. ऐसा लिखने की बजाय they wrote crescent-like structures. Now see, HIV positive patient and Gomori methenamine silver पे कुछ दिख रहा है. Honestly, there is nothing other than pneumocystis gerovicii that you are going to notice, right? Because there is only one organism that stains best with Gomori methenamine silver, and it shows you the crushed ping pong ball appearance. If you guys remember way back when we did our microbiome का जो 18th of February वाला rapid revision हुआ था, you guys remember? I gave you one mnemonic PCP 4 times you write, and then you are sorted with pneumocystis pneumonia वाला questions. Remember pneumocystis carini pneumonia, plasma cell pneumonia, crushed ping pong ball appearance. Yeah, the PCP all of them were there. So yeah, even if okay, Cryptococcus was also one option. Never mind, Cryptococcus भी हो अगर, then also crescent like crushed ping pong ball appearance with non-cultivable bronchoalveolar lavage is still going to be a pneumocystis carini also. ठीक है, any other questions that are coming? I'll take up. अभी जो questions हो रहे हैं, give me answers to that. Any other question you feel that उसमें change करना है नहीं करना है, we definitely come back to that. I'll come back to the AIHA वाला question also. Dr. Neet PG 23 will sort it out. ठीक है, I just have to go back and forth in the slides and get very confusing. So जल्दी से let's look at the questions and then we'll come back to any changes that you want to make definitely. Okay, so this was pneumocystis jirovecii, black color GMS, so sorted. Okay, let's move on to the next one. Again, a lot of confusion that happened over here because many of you said, ma'am, cement industry aa gaya, as soon as cement industry comes in the question, we get confused between asbestosis, silicosis. These are the two. Let's just omit all the options. Let's address the main concern, asbestosis versus silicosis, which would have been asbestosis versus silicosis being either totally normal confusion to have. But if this sentence was mentioned, guys, if mesothelioma is something that was there written in the paper, I don't think there could have been any confusion for you guys to have. Mesothelioma diagnosed ho gaya, then silicosis to sochna hi nahi. Then you just have to think of asbestosis. There is no other, you know, that the most specific tumor to have with asbestosis is going to be mesothelioma. Then all the cement and any other bottom industry on this planet was irrelevant. Then mesothelioma ho gaya, matlab there was, everyone is saying 1000% mesothelioma tha, then pakka the answer is asbestosis. I'm not saying cement industry does not expose you to silica, it does, but examiner has sorted the confusion. Mesothelioma kara diya, matlab it is asbestosis. So the most specific carcinoma, most specific tumor with asbestos was mesothelioma. Someone was saying anthracosis was also there. Okay, maybe in anthracosis they wanted to tell you about that coal workers pneumoconiosis, but either way, coal workers pneumoconiosis में भी mesothelioma तो नहीं बोला. But yeah, thank you for completing our options. Big thank you for that. But answer हमारा अभी भी same है, and that is going to be asbestosis. Very good. ठीक है. चलो, this is also done. Let's move on to another question which I have not got completely, but I didn't spend time getting it completely because here we've come for a hat trick. This is a hat trick for crumpled tissue paper appearance. I assume that you got a picture, but like I said, I did not spend too much time on this question because even a non-medico by now, anyone who's scrolling through YouTube now has also come up what to know कि ये कोई medicos है, यही पढ़ते रहते हैं. They keep studying this all the time, and that is crumpled tissue paper appearance is what you see in Gaucher's disease. Yeah, many of you later on, I thought it came as a one-liner or an image. You know, yeah, by now you know it's a hat trick. It has come in. It has come in, you know, every possible exam in the last 2-3 times. Okay, this is news to me. 4 images came. Honestly telling you, I was not aware of this. I mean, 4 options tak to theek tha. They started giving 4 images, but were the 4 images easy? Matlab ho gaya na at the end of the day. That is my only concern. Oh, and you felt that you could not do those images, so you got stuck somewhere. Or but images were there, but sort of हो गया होगा. ठीक है, thank God. So fingers crossed. हो गया. No, the enzyme deficiency, G for Gaucher, G for glucocerebrosidase deficiency. हो गया मैम. ठीक है. And as for the 4 images, I'm making a note of it because when I put up the final recall video on the app, I'll make sure that I have 4 images and I'll take you know, a poll on that also from all of you. So yeah, thank you for that update. But again, this is like you don't even need to learn it. All future exams are by default going to have this as one question, so at least get your one question correct every time on the basis of this. Yeah, and usually they don't give only this Gaucher. I don't know इस बार कैसे आया, but Gaucher they try to make it very difficult. They will give you some hepatosplenomegaly, long history. They will try to give you, you know, ना Gaucher में ouch होता है. Ouch matlab they will give you some history of a bone pain also. That is another thing that they give you. Then they try to mention that bone pain. They try to link it with radiology. They try to tell you that the patient is showing osteopenia, Erlen class deformity. ऐसा करके they make it very very long as a history. But in the end when you study, ये crumpled tissue paper Gaucher's है ना. ठीक है. So anemia and bone pain was there. देखा हो गया. Long history हो या जैसा भी हो. Let's not spend more time on this because either way the answer was very simple. This was a clear cut case of Gaucher's disease. ठीक है. Let's move on to the next one. This was interesting. Here I had a question, guys, where you had they did not, you know, we had done this, but it was like this question. I don't know. This question I feel is God sent. Why do I say it is God sent? Is because honestly, if you guys remember, very close to the exam, what on March 2nd, now we had that microbiology ka one-liners, and then everyone was like, ma'am, we just left. You know, you put that big responsibility on my shoulders, and you said, ma'am, we have left microbiology on you, and I was having palpitations. You know, what should I do that inka micro ho bhi jaye, and you know they get good marks also. And trust me, if you look at that session in that entire immunology, I was like, अब time नहीं है क्या पढ़ाओ क्या नहीं पढ़ाओ. I was like totally genuinely having a sleepless night. Okay, what should I and how should I cover 8 hours of immunology in 2 one-liners? So we ended up, it was like I actually closed my eyes and I thought, क्या पढ़ाएं? And this is the thing that came to my mind. And I said, okay, let me teach them the agglutination and the precipitation reactions. Genuinely, I feel this was God sent gut feeling because if you guys remember, we did a mnemonic right on the last session, last slide. Cat sat on a mat. Do you remember? And I said, ठीक है बस इतना याद कर जाओ. This is not something that I was also expecting. I just felt that कुछ तो important पढ़ाना है, and this is one of them, right? So cat sat on a mat was cold agglutination test, standard agglutination test, and microscopic agglutination test. And what do you do it for? We had studied cat मतलब my belly. Do you remember? My belly for cat. Cold agglutination test for mycoplasma, standard agglutination test for brucellosis, and microscopic agglutination test for leptospira. What is it about leptospira that you have to know? Leptospira is going to have this. Usually they give you rice field workers. Rice field workers matlab because they want to tell you something to do with water contamination. Instead of giving you rainy water contamination, they give you something to do with just seepage workers. So either way, कुछ water contamination तो करा मैंने and leptospirosis का hint हुआ. And similarly, conjunctival red test with headaches. They were talking about that very famous Weil's disease. So microscopic agglutination test हो गया. That is sorted. And others, Paul Banner to Epstein-Barr virus ka hai totally different off-track thing. Bean Felix is for what, guys? Bean Felix received up till now are these 4 options, but either way, it's a clear-cut question tha. And yeah, so I'm happy that in a way this question came, and it must have got a little tiny smile on your face. That अच्छा, thankfully abhi padha wala questions about that with you, and happiness. So chalo, this was done. Everyone was expecting this question, and again, I was also very happy as soon as. So the best is the students came out of the exam and did not tell me, ma'am, there was a question. Everyone just came and started writing on Telegram, cat sat on a mat, and I understood kuch to cat sat on a mat has come, and whatever it is, they've done it correctly. As long as they've done it, marked it right, that is all that matters. Okay, chalo, let's move on to the next. यहाँ भी discuss करा. I think it's just been repeated in a different manner. Periventricular calcification. So their favorite radiology का calcification. See, brain kind of that's what you see even in toxoplasma. You know, toxoplasma was also there. Whenever अगर some CMB का बच्चा वाला history comes ना, go in the exam and write C, M and B बस ऐसा कुछ फोटो बना लेना CMB, you know why? Because C will tell you C for cataract. C is also looking like these 2 ears, na? So these patients will have hearing loss also. C will also tell you chorioretinitis. C will also tell you chorioretinitis. B over here will tell you which calcification, periventricular calcification, and M will tell you microcephaly. So these are some important points that you see in a case of cytomegalovirus. This is how we learn it. So if you see the lectures which I am currently recording for, it's a process. But yeah, I'm trying to put up some photos like this so that micro becomes a little easier for you guys. And yeah, this is how you just have to make this sort of a diagram and like this sorted. So periventricular calcification. So CMB had 2 questions again, something which is their favorite thing to do. एक ही topic से 2 questions दे दो. Okay, let's move forward. Someone also said I don't know, sensory neural hearing loss was a part of this question or was it a part of that rubella wala question? So that again you can only tell me that whether that question was there. We'll come to that. We are coming to all of them quickly. Quiz F and C. That's all that you have to learn. That's all that you have to learn. So one is what? अगर schistosoma पूछते, if they would have asked schistosoma, you would have marked S. That is squamous cell carcinoma of the urinary bladder. And if they asked you clonorchis, then you would have marked C. Clonorchis is what? It is going to be cholangiocarcinoma. So simple था. I think clonorchis is what most students told me. So if it was clonorchis, it was a case of cholangiocarcinoma. And I see how everyone is saying clonorfish and either का mnemonics are also coming in your way. But अब ठीक है, थोड़ा भूल जाओ. Your exam is done. So you can let all the fish and the cyclops and whatnot for the time being get out of your brain. Someday else in life it will help you. But अभी के लिए you can kind of help. अभी नहीं होगा because you're going to dream of it also. You'll have like withdrawal symptoms also you'll have because you're just not used to staying that empty-minded and not juggling between a million things. So it's going to take a few days for you to settle into that feeling, okay? But yeah, this was clonorchis, this was cholangiocarcinoma, no doubt about that. Let's move on to the next question. Was this a question or were some students just doing a recall of the previous year exam? Was there a question on sterile pyuria and putty kidney to do with tuberculosis with the radiology image or not image? Because this is an exact EYQ that came. So was there a putty kidney question that was there? It was. Oh wow, so this is another like exact repeat as it is उठा के दे दिया, another नहीं टाइप लगाया. So same figure, इनका favorite by the way radiology का figure है. They have, you Google it also, there is no other figure available. So यही photo बार-बार is going to come. And this is the picture where you can see this classical calcified putty kidney which is put up over here, and that's putty kidney with sterile pyuria. यही history है, यही photo है, and you know that this is gross neck. They would want to ask you because it's a case of TB. It's going to show you which necrosis. It will show you caseous necrosis. ठीक है, ये sorted. We are coming to the LD40 question. Just give me a few more minutes. Let's move on to the next one. This again, there are some questions now. When I heard, I said, "Abhi iske baare mein let me not find out more information because they were straightforward." So there was measles. I told you, देखो, अब ना same governing body has that overlap always. In the FMG exam, they gave you the measles का 3 C's, cough coryza conjunctivitis, and in the Neet PG exam, they gave you complex spot with rash. है ना? So image was not there. Image I've just got for students who are going in for future exams. Image नहीं दिया था, but that is how complex spots look like next to the molar buccal mucosa next to the molars. But yeah, definitely this was one of the questions which must have, if you were in your dip in your exam, you would have seen this question, jumped on to the answer of measles and felt a little better that how much aata hai, and I'm getting that confidence of moving forward, right? Okay, yeah. So was there a question on Dr. Alia saying what didn't think giant cell was it there? This honestly I have not got this recall as of now, but agar tha to the more the better, of course. Why not? We all know that what didn't think giant cells are also seen in measles. ठीक है, और नहीं था तो very sad because then if it would have been there, I would have definitely got it right, isn't it? तो नहीं था. Some saying no, some saying yes. अभी I don't know, all of you gave the same exam, but some were hallucinating, some were not. Either way, this happens. Sometimes you feel that this question was pakka there, but no one else is telling that this question was there. It takes for your mind to settle for a few days. That will happen. So some of you will hallucinate a few questions. I'm coming to rotavirus. Just moving on, coming gradually. Achha, chalo. This is another controversial question that there was an HIV positive patient with umbilicated papules, and firstly, if umbilicated papules was mentioned, so this is what you can tell me. Umbilicated papules mentioned था. This is one of the classical descriptions that they give you for molluscum. If you ask me that can HIV positive patients have molluscum, of course they can. Molluscum contagiosum virus has many forms. MCV1, molluscum contagiosum virus 2. So some forms occur in normal immunocompetent people, some occur in immunocompromised people. So basically HIV positive patient में molluscum infections can definitely happen. So this is there. IBQ था. I know this umbilicated lesion. I was going to copy paste the most famous umbilicated lesion to Google पे है, but many students told me that I was not the picture. So I'm yet to, wherever I'm writing note, मतलब I'm yet to get the exact picture because the usual photo which has been coming till date was not there in the paper. So they were saying there was some face photo with multiple lesions. I really tried to Google to the 10th page of Google, but I have not found the exact photos. I'm in that process, and once I do, I'll put it up to you guys. ठीक है? ये question नहीं था. Some of you are saying ये question नहीं था, but some of you are definitely saying that molluscum था. So and it was quite characteristic regarding umbilicated. So yeah. Okay, let's move forward. Maybe there are 2-3 questions जिसमें आपस में confusion हो रहा है. So maybe we will sort it. Maybe you see the other questions, and then in the end you can let me know that whether you were mixing up the two or whether they were genuinely individual questions. Next one, a 5-year-old child with meningitis showing you low sugar and high WBC, something which is indicative of some pyrogenic meningitis, but the take-home message and the giveaway was a gram-negative pleomorphic organism. This has to be hemophilus. Gram-negative and pleomorphic. So hemophilus is known to be gram-negative and pleomorphic. Hemophilus influenza. What does it show you? What is the next step that you're going to do? That is going to be the satellitism. Satellitism you see on this blood agar and chocolate agar. What have you put in the center for satellitism? In the center you have put something called Staph aureus. And satellitism, H influenza will grow just around the satellite. It is going to grow just around the satellite. So that was satellitism that you saw with the presence of Staph aureus. ठीक है, तो yeah, this is तो definitely there. Meanwhile, many of you, ये तो question में कोई doubt नहीं है. Even if satellitism was not there, instead of satellitism, they had written blood or chocolate agar in the presence of Staph aureus. That also means the same, because ultimately what you use in a case of satellitism is these two media, right? So, and if anyone can recall the other options, please bata do. But abhi tak at least 200 odd students whom I have spoken to have given me the same question with this word only, so I assume that they gave me the right one. Okay, so yeah, many students here are also saying कि ये था, but अगर if there is any confusion, we can definitely look into it. You definitely see that अगर कोई confusion था. Gram negative, of course, happened. Why am I calling it Haemophilus influenza? Because it is coming under a gram negative bacillus, which is pleomorphic. That is my primary concern of calling it a Haemophilus with meningitis in a child, of course. Okay, so I put a star here just in case you guys come up with anything you feel you want to add on to the options. Please do let me know. We are obviously going to have a final PDF being sent out to all of you, which will have the closest possible recalls. We can definitely. Why not gonorrhea? Gonorrhea, other question. Gonorrhea was a question where a peripheral smear or some intracellular organism was given. So this is not fitting into gonorrhea anyway. Okay. Neisseria meningitis is what you're talking about, but Neisseria meningitis is not a bacillus. No? Neisseria meningitis is a cocci. And many students, although it's not written here, but many students told me if it was a gram-negative bacilli, pleomorphic bacillus, and pleomorphic Neisseria meningitis is not pleomorphic. Neisseria meningitis is a lens-shaped organism with a capsule. So that is how Neisseria meningitis looks like. Okay. Chalo, moving on to the next question, guys. There was something like this which a lot of you are asking me since a great while. There was some Rajasthan resident with an ulcer, some cutaneous basically manifestation, and the question to do with kinetoblast. So first and foremost, basically something to do with LD bodies were there. I hope all of you were able to differentiate LD bodies. Yes, right? LD bodies ka I have told you big dot, small dot story yaad hai, that there is a big dot and a small dot, and that is how to differentiate LD bodies. Yeah, so first and foremost, this is what they were talking about. If they had mentioned, I don't know, abhi bata do, was this history something like this there, resident of Rajasthan? So they probably wanted to tell you something about the cutaneous manifestations. And cutaneous, I have mentioned in the questions only regarding LD bodies, which is even better. And if image was not there, that is so even better. I mean, what better can I say, that I don't have to zoom in and strain my eyes? Direct likha hai LD body kinetoblast. I can't ask God for more. And of course, it is known as the Alico button. It is also known as the Delhi boil, and it is caused by leishmania. So that was in the options. Then you had to mark that. Okay. LD body photo nahi diya, so I always say it's better. Liख diya, so even better. Then my mind has no doubt only. Na? So even if kinetoblast was mentioned, I've written the buzzword kinetoblast. At least I knew that yeah, they were definitely talking about the LD. Even if only leishmania was there, then also that's what I'm saying. The options that you are giving me are making the process even simpler. You are saying image nahi tha, tropica mentioned nahi tha. That is making your life simpler and simpler. Answer was leishmania. Seedha question, that was leishmania. Okay. Chalo. Moving on to the next, some of you have been asking me about this HRP2 antigen. Firstly, HRP2 antigen is histidine-rich protein. Histidine-rich protein is present. Actually, this picture must have not been there. I have just got for reference for the future exam students. This histidine-rich protein is something which is present in Plasmodium falciparum. Achha, meanwhile, on the previous one, because छोटा सा lag होता है. So many of you are saying tropica था, तो tropica था, तो very very good, बहुत अच्छी बात है. चलो, so that makes it tropica. Moving on, Plasmodium falciparum. So please remember, there's a very easy way of learning when you're talking about all the different types of malaria, and they ask you all the malarias have what? All falciparum, malaria, ovale, knowles, कोई भी malaria होगा, all will have A for alveolus, they will have A for alveolus, and they will have L for LDH. So these are some serum. It is histidine-rich protein 2, which is present in Plasmodium falciparum, and that is the basis of test. So जो malaria का card test होता है, yes, that is somewhere. Picture again, guys. I'm saying ना, picture only for reference. Photo exam में नहीं आया. This is only for reference. And you use this HRP2 antigen testing for these card tests. So you get used to little bit MCQ से बाहर निकलो. Your source is going to enter residency. This is the test that you will be doing day in and day out, because malaria season आएगा, and everyone in your ward or your OT or your OPD is going to land up with fever with chills, and this is exactly what your life is going to have a transition not very soon, thanks to the long wait you have, but very soon. I can still say your life is going to transform from reading HRP2 to doing this test, right? So this is a transition very soon that is going to happen to all of you. Let's move on to the next question. Yeah, so in this question, you can see that there was there was a carcinoma which was associated with some HIV positive person that was mentioned. Which usually they pick up non-copyright wala photos from Wikipedia and all, but this time they picked up the photo from one of the best journals of the country, that is the New England Journal of Medicine. Ka photo hai, as I was googling, I found out that this is the carcinoma associated with HIV positive. Ye photo ko 1 second ke liye forget this picture. The options were, what all options I got was Kaposi, squamous cell, someone said basal cell, and malignant melanoma. Aisa kuch options tha. You can tell me about the option, be right or not. I was not concerned about the options. I tell you why, because they said HIV positive. Now when it comes to cancers, now I know the most common, if only most common cancer would have been asked, so actually carcinoma word nahi hoga, they must have asked you some cancer. So cancer puchte, so actually it is a non-Hodgkin's lymphoma, the most common cancer that happens in HIV positive patients. But non-Hodgkin's lymphoma was not there in the question, so then I go on to the second most common cancer. The second most common cancer is Kaposi sarcoma, which was there in the options. So then we go select kara, and also I can see these lesions have a little bit of this reddish appearance that we have. So right, when I'm talking about this reddish appearance, matlab it is a vascular tumor, and I know Kaposi sarcoma is a vascular tumor. Actually, this is a dermatology question. Why? Because Kaposi sarcoma kahan hota hai? Kaposi sarcoma is usually a cutaneous tumor. It happens on the legs, limbs, the lower limbs, the thighs. That is a cutaneous vascular tumor. It occurs on the skin of the lower limbs. However, Kaposi sarcoma, you remember, has many types. Ye to common type hai. There is an HIV positive type of Kaposi sarcoma, and that HIV positive wala Kaposi can occur anywhere in the body, not just on the lower limbs or the thigh. It can happen anywhere in the body, and that is why they have shown you the rare side of the palate, showing you these nodular lesions of KS. ठीक है, सॉर्टेड गाइस, इसमें तो देयर इज नो कंफ्यूजन ना, ये तो फोटो एज इट इज आया था. सो आई होप दिस इज सॉर्टेड. नाउ दिस इज द नेक्स्ट वन दैट यू हैव, which I famously, this is the story that I always teach students, that rubella. So rubella sounds like Rona. So this is a person who is, it's a very funny story actually, and this is a girl called Bella, and uske प्यार में अंधा and बहरा. So he's crying because he is अंधा and बहरा in her love. So प्यार में means love, patent ductus arteriosus. अंधा and बहरा basically means अंधा because of cataract and बहरा because of sensory neural hearing loss. So that is the classical triad which I always teach students for rubella. So right, in the love of rubella, he has gone deaf and blind. प्यार में अंधा बहरा is what we had to do. And even if you did not know this mnemonic, maybe you have not studied from me earlier, even if you did not know this mnemonic, pretty question overall simple. PDA with SNHL with cataract with the classical triad that was there in rubella syndrome. So there were basically two congenital things. Again, congenital के पीछे पड़ गए. First, they ask you about the periventricular calcification that you can see in cases of CMP, and secondly, they ask you this triad classically that was there was rubella. Okay, now let's move on to the next question. This was a question again which I have not, or I have got a few recaps from students, but everyone's giving me such random recalls that I could not formulate a question only out of it. बस सबने कहा मुझे मैम कुछ फाइलेरिया था और नेक्स्ट स्टेप पूछा. फाइलेरिया का क्या था? Was it a photo? Was it elephantiasis? Was it? Okay, finally I got a lead to that question. Filarial antigen test is positive, and is this that what you're going to do, Dr. Ankit? The volume seems to be fine for everyone else is what they told me, so just take bar off on kar lo. I think it will be sorted. Okay, someone said Ganga history tha. That is the best recall that I've got till now. Perfect. Ganga history tha, bilkul bilkul. Ab to now that your exam is over, ab to ye bologe ma'am kuch Ganga history tha. Till yesterday night everyone was like, "Arey ma'am, tough history, easy history." Now it has become Ganga history. That is what happens. Okay, filarial antigen was positive, and a Bihar history was given. Okay, either way, I can understand that this is filarial antigen. Okay, that's a big lead for me, because now when they ask you what is the next step that you're going to do, you're going to do a DC propagation test. Why? Because I know filarial pattern. No, filaria will be seen best between 10 to 2 best thing to do is that you're going to do a DEC provocation test, and after sequence, ma'am, will we select a peripheral smear or will we select DEC provocation test? Okay, logically, filarial antigen has come positive. You can do a peripheral smear also, but what do you do after a DEC provocation test? What is the DEC test? You give the patient this drug dicarbonazine, and after this you do a peripheral smear only, to see the filaria. Ultimately, if you have to see a microfilaria, you will have to do a peripheral smear. But before that peripheral smear, you will have to give a DEC. So, pehle DEC, and then after that you are going to find out the organism on the peripheral smear, isn't it? Someone said there was history of weight loss also present. Okay, these must have been miscellaneous findings with hepatosplenomegaly present. So, wo sab ho sakta hai, definitely there. Okay, so microfilaria smear, you're right, Dr. Sakshi, but microfilaria smear se pehle you will want to do a DEC provocation test now, and after that, what is a DEC provocation test? You give the patient a drug called DEC, and then you take his blood sample, and from that blood sample you make a peripheral smear. So why do you want to directly jump and make a peripheral smear? First give him the drug, and then in that drug this is included. If you're giving the drug, you're giving him a reason that after that you take his blood sample and you see the peripheral smear. Okay? Okay, so they want to find out microfilaria. Blood में तो microfilaria दिखता है ना. Adult worms don't come out into the blood. Adult worms are sitting in the lymph node. Adult worm you will see on a lymph node biopsy. They have gone and sat over there in the blood. You will see night time को microfilaria are there. ठीक है, everyone is sorted, and yeah, if next step with us, confirmatory तो हर चीज में ultimately becomes your PCR. I mean, there's nothing beyond genetics, of course, but no one has to go till that level. Usually, a DEC provocation test with a filaria antigen becomes good too. Achha, there's another incomplete question that I have. I think last one or two quickly left. Let's wrap it up, guys. There's a female with multiple sexual partners with lower abdominal pain and some greenish discharge for vagina. Someone said the fancy lady story came, so fancy lady story must have been associated with this only. And so which of the following statement is incorrect? Saline wet mount. I have not got all the 4 options, so honestly I don't want to comment on it, but one of the options that I got was this, so definitely incorrect. It's like the biggest false option ever on this planet, because when you're talking about greenish discharge for vagina, when you're talking about a sexually transmitted disease, you're talking about trichomonas. You're talking about trichomonas. And when you're talking about trichomonas, you know tree, सब कुछ trophozoid switching motility, सब कुछ TTT है, cyst form does not exist. So if they had asked you the wrong statement, then definitely it was this. That was the cyst form. ये तो possibility ही नहीं. Other options, I still say that I don't want to give you the complete answer to this one, because I don't know what the other options are. Correct पूछा था, incorrect पूछा था, तो that if so what the student exactly wrote to me on Telegram and gave me, it could be right, it could be wrong. That is exactly was correct पूछा था, so then the entire question is only going to change. Then of course the first option becomes the correct one. Trophozoites show you twitching motility. Then ये correct हो जाता है. The only thing that you need to do is correct पूछा था या incorrect पूछा था, but your concept remains the same, isn't it? And yeah, this everyone told me that the examiner was pretty obsessed with 2-3 things this time, be it an HIV positive person, or be it a sexually transmitted disease, or be it alcohol. ये इस time का hot topics था. These were the hot topics of this particular paper. Students going forward with the exam, they can definitely keep note that these are NB वालों का favorite options. Okay, one option with twitching motility. Fine. So guys, we'll work around on this question more, and we will definitely cultivable होता है. Doctor, someone asked me trichomonas is non-cultivable. Was that an option? Because the cultivable होता है. You all remember I told you that fancy auntie trichomonas is that fancy auntie who likes diamonds. So I told you that diamond culture is there for trichomonas. So cultured होता है. This was one of the options that it cannot be cultured. तो वो तो true नहीं था. Very good. Thank you for that recall. If it cannot be cultured was an option, I'll add that. And if anyone can recall the fourth one, तो वो भी बता देना. Another option everyone is saying, ma'am सबके अंदर तो hepatosplenomegaly. Everyone had hepatosplenomegaly. I know whether it is your AIHA वाला question versus HS, which right now the family history वाला big doubt है. So yeah, every other question had HSM of course. ठीक है, अभी तो story is not over. I have the next question. This question only one or two students told me. आया था नहीं आया था? Was it like an hallucination of a few students that were there? Painless ulcer with painless inguinal lymphadenopathy. If it came, it was a case of syphilis because I told you that syphilis में सब कुछ less होता है. It was there. तो चलो जो right मतलब सब ठीक है तो easy वाला question था ना. Syphilis में सब कुछ less होता है. Means the ulcer is also painless. The inguinal lymphadenopathy is also painless. Well, they would have mentioned chancroid. Chancroid sounds like cry. That is caused by Haemophilus ducrei. That is crying वाला organism, crying with pain. इसमें सब कुछ painful होता है, right? So remember, syphilis was the answer because syphilis has something painless. तो ये आया था, चलो finally everyone is having a consensus on this. Dr. Sakshi, giardia shows you falling leaf motility, not twitching motility. ठीक है, falling leaf, गिरता हुआ man, falling leaf motility. ठीक है, चलो I think any other question? This was also a question again. इसका image I am yet to search. These are I've kept all the incomplete questions for the end. अभी भी I am on that process of interacting with students. So I've heard that gonococci was a question of some intracellular gram-negative cocci that was mentioned. And if that image was given, then they had asked you the drug of choice, which is ceftriaxone. That was definitely a question that was there. Yes, this was there. So Aman said, "Ma'am, सारे subjects पढ़ा दो, no Dr. Amar. Right now it is just math and micro. But I hope someday if I get time from my lab duties and hospital duties, someday definitely." So ये simple था. बस last question left, which everyone is waiting for. Rotavirus question. Don't worry, we're not going to leave it. Rotavirus question का answer. What do you do for the detection of rotavirus? It is viral antigen in stool. Antigen testing is usually. I don't think this was written. Can I read it? I don't know. Antigen testing is done by a process called ELISA. So viral antigen in the stool is what you're going to be rotavirus. Antibody testing was also one of the options that I have been told by students. Antibody is not the ideal way of mentioning or talking about rotavirus detection. It is antigen testing always in the stool, which is going to be there. ठीक है, ELISA नहीं लिखा होगा. I'm just telling you some of the things I've written so that some of our juniors can also get benefited for it. Most of likely must have been viral antigen. इतना इतना option होगा. But yeah, for the future student, you should know whether it is antigen or antibody. It is tested by something known as ELISA. Light microscopy was one option. वो तो बिल्कुल भी नहीं हो सकता because viruses तो are not seen on light microscopy. Viruses are seen only on those black and white photos. Electron microscopy. ठीक है, तो then this was obviously not totally out of the domain as I said. Fine. So yeah, as of now, there are 5 or 6 questions overall that I would say that I need to still work up a little on, which means that I will keep poking you on Telegram and another social media platform and keep asking you, because not only will that give you your answer, that will also help all of your juniors in getting the the PYQ, because you know that this exam was about a lot of PYQs. But I will be very honest, it's very easy to say सब कुछ PYQ आया था and you guys should have just done your PYQs. It was recycled PYQs. PYQs were there, topics were repeated, but they were very smartly repeated with options being very close. Some 50-60 questions I have over the options. Topic देखने में लगा super simple, but when you started reading the options, it did give your mind a little bit of doubt. Those kind of questions were definitely there. So basically, it was a PYQ based paper, but with its own set of twists and turns. Certainly was there. Okay, so hemarthrosis but no gum bleeding. Dr. Satvik, if that was a question, we will think of hemarthrosis. Clotting factor bleeding ज़्यादा होता है. We will think more in favor of hemophilia A being so. Is what we will be thinking of. I'll work out that question more, but on the basis of what you told me, hemarthrosis का factor 8 and 9 is what we think of. Right? Okay, so yeah, for those who are asking me about the lectures, pathology lectures you must have seen on Prep Ladder are almost uploaded. In another day, the entire path is going to be complete by tomorrow, and microbiology is going on by the 3rd or 4th week of March.
Blood pressure is large electrode in average 20 times expecting of no causality. Here बार दे सकता है small round lymphocytes one cell molecular now 50 okay because EAC or rates okay they all are available for the 60 mega keracytic erythroid is like erythema viruses the volume disease and but it's not lymphocytic biological inflammation process from his myocardial patient present in fatigue, pain, cardiac shock, and gathering Yes, primary, secondary, and not in a quaternary. Expressness. Oh, oh, see, yes, very good, yes. Localized collection of persons in present. Upon the autonomic destruction of fluid, muscles are not different from pulmonary embolism. Sudden breathlessness, chest and hypotension might occur. In this section, hypotension might occur. Transient Insulin dental infection, especially in Ronnie neck swelling, elevation of tongue, difficulty in swallowing, breathing, repeat halitosis, Christmas fever. Ronnie neck swelling, elevation of tongue, some ventricular wrong with swelling, repeat halitosis, with the radiation present chemical parafollicular secrete calcitonin and 2A and 2B syndrome. Associated typically as a firm thyroid, not strongly liquid radiation doesn't fit the post radiation group. Affected the most common thyroid cancer, especially young female, is female lateral, pendulous thyroid, ipsilateral cervical lymphopathy, slow growing via lymphatic patient, usually euthyroid. Lymphoma usually present with rapidly increasing thyroid. When rapidly increasing thyroid associated with thyroid Hashimoto thyroiditis may cause compression or young euthyroid with chronic pyrethroism not typically. Older adult follicular lymphoma, older adult hematogenous fat, no significant radiation occurred. Young female, prior neck radiation, spreads via cervical lymphadenopathy, orphan any eye nuclei and zamoma bodies. Zamoma bodies and orphan any eye nuclei. Papillary carcinoma, thyroid, um, medulloblastoma, papillary carcinoma of ovary, euthyroid set, more present have euthyroid. Excellent slowing, FNSC, ultrasound confirmed. Surgical OPD with complete surgery, cystic fibroma, it's a transfer. Usually present discharging sinus, brachial dysphagia. They were not soft, cystic or transluminal. Firm structural sharing, non-transluminal. Brachial cyst is non-transluminal. Cystic angle is transilluminal. Okay, transilluminal. Posterior triangle of neck, soft, cystic, non-tender, biliary transluminal, compressible. Classic syndrome of cystic fibroma. Or from protrusion. Thyroglobulin level is important marker in papillary cancer of thyroid. Calcium. Arising from follicular cell which produces thyroglobulin. At the papillary thyroid cancer. Aggressive or differential most poor. Thyroglobulin is not secreted. एक month old child. Pain thing. Discless. There in the part so many hours. When abdominal pain, distance and vomiting with a red and jelly soup. But in colicky abdominal pain, drawing of red, red current jelly stools, empty dance sign जो dance sign empty right in the possible sausage mass child become restless lethargic during the episode rectal prolapse visually visible protruding rectal mass during the straining or defecation doesn't cause colicky pain or blood stain because for rectum inter no abdominal mass or dance midgut volvulus can present bilious vomiting sign of bowel obstruction often in neonates. It does not typically show intermittent pain or recurrent disease. From 6 to 12 months common investigation of bowel like symptom like intermittent colic, drawing of leg, lethargy, vision observed, red current jelly stool, blood, Goras muscle, diet signs, right iliac fossa diagnosis is ultrasound, air contrast. Okay. Cecal perforation is auxiliary syndrome is colonic pseudo obstruction. The distension of colon and symptom of acute colonic obstruction. Distension of colon high. Any acute physical cause न जो हमारे metabolic causes diabetes, hypokalemia, uremia, myxedema, and intermittent porphyria. Diabetes, hypokalemia, uremia, myxedema, and intermittent porphyria. Lumbar spine and coronary. Never post-operative state, blood, urine, and dying tumor, drugs, tricyclic GI involvement. Colonic obstruction, myelin later lead to perforation, urgent colonoscopy, contrasting in a CT scan, Michael Pearson not GQ, IV neostigmine, colonoscopic decompression. Increases if cecal diameter size become greater than 14 cm. Normal is equal to 7. Systemic blockade via epidural anesthesia may help relieve in pseudo obstruction surgery reserved for patients with impending color. Confirmed problem has high mortality. Risk factor is acute colonic obstruction, fertility or senility, neurological disease, neurodegenerative disease, stroke, spinal cord injury, trauma, cervical vertebral, pelvic, major gynecological surgery, obstetric surgery, including cesarean section, systemic inflammation, sepsis, trauma, especially with multiple area, localized infection, respiratory, urinary, myocardial infarction.